Good morning, Brian Place. Thank you very much for being with us this morning as a patient representative. And we're here to talk about the Patient Experience Survey programme. In particular, the Patient Experience Survey that's coming out in May of 2017. And I was wondering if you could tell us what you think about what is patient experience versus patient satisfaction.
Yeah, good question, Tracy. Patient experience, to my mind, would be far more all-embracing than patient satisfaction, and will, I think, capture everything that a patient experiences, warts and all, good, bad and indifferent, the whole spectrum. So I think it's a far more wide-ranging exercise.
And from your point of view, what are the benefits of capturing patient experience information?
I think there are multifarious beneficiaries, if I'm honest. First of all, the patients themselves. If you have a survey, patients have had a chance to say something about their experience. The outcome, the output of the survey should inform hospitals, hospital groups, the HSE and the Department of Health in terms of policy. And unless we have a baseline of this information, we cannot measure ourselves for improvements or disimprovements in the future.
Patients have been involved in selecting the questions to be included in this questionnaire. Do you think it'll capture patient experience well?
I understand that in New Zealand they run, perhaps on a more frequent basis, a 20-question questionnaire. In Germany, I think possibly a 37-question questionnaire. This is 61 questions. I think it has the capacity to pretty fully encapsulate the total patient experience. In addition, there are 3 qualitative questions, which I think will be vital in terms of giving patients an opportunity to express anything that isn't covered by the questionnaire. So in total, I think very likely a very good capture.
And how would you like to see this information to be used?
Well, as I indicated earlier, it ought to be used, first of all, I think, by the hospitals themselves. And my own personal view is that if it had a question about which ward, this would also be useful. But then by the hospital group, and of course by the HSE, and of course the Department of Health. And most important, I think, unless we see what is good and what is bad about our system, we can't really adjust in a quality improvement plan.
Patients' views can make a difference, and have you ever seen examples of this in practice?
Well, as I think you may have mentioned at the outset, I'm on the Saolta Group Hospital Patient Council, Saolta Hospital Group Patient Council, and we have been making efforts to improve things based on patient feedback. Notably, parking is kind of appalling in 1 or 2 of the hospitals in the group, and we are making slow but measurable progress. So I think yes, the answer is yes.
Great. Thank you very much for being with us.
A pleasure meeting you. Thank you.